Hello everyone, and welcome to the last session of the year. Actually, this is going to be a Bugs of the Month session. And we have a case of a 4-year-old female patient who initially develops fever while she's abroad, on vacation abroad, and then it comes back home and presents to our hospital with persistent fever and is found to have splenomegaly and pancytopenia. So a bone marrow biopsy is taken, and when we examine the bone marrow biopsy, we can see that there are increased megakaryocytes. There are also increased macrophages, which is why it slipped. And when you zoom in, what draws our attention is that there are these round bodies, most probably intracellular and most probably inside macrophages, as you can see, and they look like they're all kind of similar in size, unlike debris that could be found due to high cell turnover inside these, the monocytes and macrophages and the histiocytes within the bone marrow. Over here you can see that there are quite a lot. I'm going to zoom in a minute, but I just want you to savor this for a moment. Now with oil immersion, you can actually even make out that these round bodies, they've got eccentric nuclei, and this immediately, of course, raises the question of leishmaniasis, visceral leishmaniasis. It could, of course, also be histoplasmosis, and we're going to find out in a second with the aspirate smears by viewing them. You can see that there's so many of them. Small round bodies. Stuffed macrophages. There they are. And they've got eccentric nuclei. And when you examine the aspirate, yeah, that looks better now. You can see both intracellular and extracellular. These are actually parasites, of course. Round bodies, parasites, consistent with leishmaniasis, and I'm going to tell you why it's leishmaniasis. You can see that they've got these eccentric nuclei. Now the key is to leishmania diagnosis is you have to, within these are called amastigotes, and within the amastigotes, not only are you supposed to see the nucleus, but you're also supposed to see this rod-like structure, which is called a kinetoplast, within these amastigotes. And this is also referred to as a double dot appearance. It's classical. And the presence of this kinetoplast is what allows us to confidently diagnose leishmaniasis. And in this case, you can't always see it, of course, but in this case, we could identify these rod-shaped kinetoplasts. Here it is again. And this kinetoplast, this is actually a mitochondrial genome of the parasite, and it creates this double dot appearance, which is characteristic of leishmania, which helps us diagnose leishmania. Here's a plasma cell with a huge intranuclear inclusion, a Dutcher body, by the way, and you can see that these parasites, you can find them both extracellular, and here's the double dot appearance again, and also within, stuffing the histiocytes and macrophages. Here they are again. You can see the double dot sign. So this was a typical case of visceral leishmaniasis, which I wanted to share with you. So that's it for this year, let's say. Happy holidays to everyone.